would not start a GLP-1 medication like Wegovy, Ozempic, Zepbound, or Mounjaro without doing these two tests first. Of course, if they're accessible, no shame if they're not. The first one being a body composition test that not only tells you the difference between your lean body mass and your fat mass, but specifically how much of that lean body mass is actual muscle mass. And the reason this is important is because these medications, although work very well, they are not necessarily muscle sparing. So it's important to understand what your baseline is so that you can identify if you're losing muscle and not fat, which we don't want. We want to lose fat, not the muscle. Now, I'm not saying not to take it. I'm just saying that there are some things that you can do to prevent from that occurring. But if you're not even monitoring it, you don't know to make adjustments with your diet or your lifestyle to offset that risk. So I'd recommend that body composition test first and foremost. And then I would repeat that body composition test at minimum every 4 weeks. Second is a resting metabolic rate test or a basal metabolic rate test, specifically one that you breathe into a tube and it can determine how much oxygen that your body consumes to keep it running efficiently. This is so important because it's more common than not that people are actually under eating than they are overeating. And one of the biggest effects of taking these medications is a reduction in appetite. This can be relieving for people who struggle with things like binge eating disorder, and